Hi, I'm Dr. David Herman, and I have the honor of being the CEO of Essentia Health. And I'm here with two of my radiology colleagues today in the new St. Mary's Medical Center. And we're going to talk a little bit about the stuff that's going on here, what's new, what's different. But first, I'll have you introduce yourself.
Okay, my name's Anne, and I work in CAT scan as a technologist.
And I'm Elisa, and I am the team lead for nuclear medicine and PET CT.
This is really special space. When you and your colleagues designed this space, what type of things did you take under consideration?
Space, number one. We want ample room to be able to get our stretchers and patients into the rooms. Doorways are a big thing. Right now at the old St. Mary's Hospital, we have a lot of problems with our patients getting access into the rooms through the doors. And so they made sure that the doors were wide enough to be able to get these stretchers and wheelchairs and patients into the rooms.
Yeah. What about the space for the staff? How's that different?
The rooms are bigger, and then they can accommodate beds. We do a lot of patients from the units.
Okay.
So our space needed to be bigger.
And I noticed when we came, it's right next to the elevators as well, the transport elevators, so that'll be really, really good.
Another thing is that we've got some great space out here where patients in the old hospital used to be in the hallways. We now have some specified holding rooms that are right down the corridor here, where the patients will have some privacy to be held in those spots prior to actually being transported back to their floors.
One of the nice features of Vision Northland that will make it easier for your patients is we've separated the patient care elevators from the public elevators where visitors will be. So as a level 1 trauma center, we see a lot of things that require a CT scan or other higher level imaging. And that will be right in the emergency room. And I know that when we designed the building from the helipad, we have dedicated elevators that go from that helipad to one of 3 different places. Directly to radiology, directly to the ORs, or directly to the ED. So that'll be helpful as well.
I think that we're just all really excited to be in this new space. Everything is new, and it's really nice to be able to serve the people in this region with all brand new state-of-the-art modalities and imaging.
So we are in the room right now that has the SPEC CT. Can you tell me a little bit about what this beautiful piece of machinery does?
This is called a nuclear medicine SPEC CT system, and what it does is it allows us to get better pictures. You can do just base nuclear medicine, but the CT portion of this exam allows us to get more precise and better locations in regards to what we're doing for the exams that we're doing.
So this will be a lot better from a diagnostic standpoint and really help the physicians and the care team be able to plan the care of the patient.
That's correct.
Patients can spend a long time on one of these tables getting the tests that they need. What have we done in this room to make it just a little bit easier for them?
The bed, of course, has some different comfort measures to it than our present bed does at the old hospital. And then we've got this fantastic piece of artwork on our ceiling here. So when the patients are laying on this bed, they can look up and think that they're possibly outside or looking to the outside area, which is a little bit more calming and relaxing for them.
And I can only imagine that if you're needing a test like this, you're probably a little bit anxious anyway, and anything that can allow you to take a deep breath and calm down is probably great.
That's correct.
As a level 1 trauma center, we see people at some of the most probably frightening and vulnerable times of their lives. They come in on the helicopter, the elevator takes them right down here. We're now in a CT scan room that's right in the middle of the emergency department. How will that help the care of the patients that we're privileged to serve?
We're very excited to have our scanner right in the emergency room. And we are right across from the trauma bays, so things can move much quicker and we can be more efficient.
We talked about the way we can serve patients better. I understand in this building, some of the MRIs, 2 of them as a matter of fact, are what we call large bore MRIs. Can you tell me how they're different from a standard MRI and what the applications of those would be?
The large bore MRI scanners are better to be served for our bariatric patients.
Okay.
People who are large. Presently right now, if you have some of those large patients, unfortunately we have to refer them out to different facilities that have these large bore systems.
Okay.
But now we will be able to better serve them, being that we're going to have not 1 but 2 at our facility, which will make it a much better care for our patients to be serviced here on site.
Right. I think healthcare is always progressing, and as an organization, we want to not just be progressing along with healthcare, but we want to lead. And I would say that the development of this building with you and your colleagues and all the work and design that you've put into it, knowing your colleagues, knowing your patients, makes this a very, very special place. I'd like to thank my radiology colleagues for joining me here in the new St. Mary's Medical Center. This will be really great. We look forward to moving in later this year, which will be an exciting time. So thank you very much for taking the time and sharing this with our colleagues.